area on your body to show signs of serious conditions like diabetes and cardiovascular disease. Here to explain more, please welcome Dr. Robert Parker with Victory Healthcare's Foot and Hand Pain Center. All right. We are hearing more and more about this thing called neuropathy. We're seeing it on commercials and things like that. And so what exactly is happening in the foot, when or in other parts of the body as well, when we say that word neuropathy?
Neuropathy, actually, neuro means nerve, of course, and pathology is a pathological or disease state. So neuropathy is a disease state of the nerve, and it's manifested by symptoms that everybody knows today.
Yeah, symptoms like?
Burning, tingling, numbing, an aching pain. Really, people have numb feet, and they still say that their feet hurt, even though they're numb. It's kind of it seems like it's contra, but it's not. It's very painful.
Yeah, and different things can cause that. Diabetes, again, is one of those things that can lead to neuropathy.
And we have to ask ourselves how we get here. You don't go to bed one night and wake up with diabetes. It starts out with a condition we call metabolic syndrome. That's not a illness, but it's a finding. It's a basket with several things: high blood pressure, increased cholesterol, increased triglycerides, history of diabetes in the family. That means that you have enough. Any three of those put you in that basket of being a metabolic syndrome patient. What's happening with that patient is that the nerves are starting to swell. They're becoming diabetic. And so when nerves start to swell inside the tissues, you've got these fibroosseous tunnels that are not expanding with that nerve, then you're becoming compressed, and the whole thing is a compression issue. In fact, that process takes 10 to 20 years, as I mentioned before, and what's happening is that the nerves are being choked, and the circulation to the nerves is being choked down, and they're not healthy.
Is there a way to reverse that?
There's absolutely paradigm shifts in our profession right now. It's very exciting. This has been going on for really 2 or 3 decades. I started out by a guy named Lee Dillon at Johns Hopkins, who trained me in this surgery. And he started out with patients who had carpal tunnel. They were diabetics, and he would release the nerve here. If you're looking for the tunnel for these fingers, it would be here, carpal tunnel. The ulnar tunnel would be down here for these fingers. Well, he would release diabetic tunnels, at being a hand surgeon at Johns Hopkins. And the diabetics would say, "Dr. Donnelly, can you fix my feet?" And he went, "Well, no, I don't fix feet." That was three decades ago.
Yeah.
Now there's a whole new system.
Because it's kind of similar in the way you would address that.
It's exactly similar. Exactly. These are drawings of tarsal tunnel. You see, we used to think it was just one ligament. Now we know it's like 4 different tunnels here. And we're in literally every week opening these tunnels and restoring sensation to the nerves, because it opens up the vessels in the nerves. They can start that, what we call axoplasmic flow, which is just the proteins that make nerves work, kind of like water in a hose.
Yeah.
And if you pinch a hose down, it's going to end up with little water at the other end, and your grass will die. Well, your nerves die if you choke down nerves.
Yeah. What I like about this treatment is that, we hear a lot about medications to do things. And oftentimes, sometimes there are medications that cure things. There are other medications that just kind of help you maintain. And what you're really trying to do is just get rid of it.
It's been thought, and even today very much, that you can only treat these conditions with medicines. Well, and so you're on Lyrica, Cymbalta, and Neurontin for the rest of your life, until your nerves basically numb out and go dead on you. When they go dead, now you're on the back side of that curve. That's where ulcers, infections, and amputations occur in the diabetic. So we want to get there before you get to that point.
And just solve the problem.
Yes.
And once those procedures are done, oftentimes are they
80%. 80% get their restoration of sensation, and that 24/7 burning pain that you can't sleep, it goes away.
All right. Thank you very much.